Oh, hello, hello. Hope you all are doing so well. It's a beautiful Thursday, at least in Indiana. I don't know what the weather's like where you're at, but it's a beautiful day, and it's a beautiful day to talk about Medicare. And so we're gonna walk through turning 65, what to know about Medicare. I'm gonna pull up my screen here in just a moment, and we will get started. So give me just a moment, and we'll be off to the races. Uh, so hopefully, if you all know how to use the chat functionality, you may be able to tell me where home is for you all. Where you might be tuning in from. The chat functionality where Josie just put a note in there. She's our director of marketing. Feel free to drop notes in there, thoughts in there, questions. You can also use the Q&A functionality, and we can go from there. But really excited to be with you all. I know that everybody's been waiting, very patient to talk about Medicare today. And so you can see my screen here, turning 65, what we need to know about Medicare and why it's so important for you to know about Medicare. And so we're going to talk about some timelines. We're going to cover off on details. There will be a replay that's made available. So I've been told that I can talk quickly, and so I try to listen to some advice that I've heard that when you're presenting, that you should talk like you cook a brisket, which is low and slow. And so we're gonna go through turning 65, what you need to know about Medicare, and just really grateful to be here. David's saying hello from Murfreesboro. Was just in Nashville this week, so Indiana is home for me, but was just in Nashville for a conference, and so I'll kind of walk through a couple things about us at Move Health and who we are. If you know us already, great. If you don't, and an advisor's talked about us or you heard about us through a friend, that's okay too. But things to know about us, right? So we've got lots and lots of experience in the Medicare and health insurance pre-65 space. But today we're going to be talking about Medicare. So lots and lots of experience in the Medicare space. I've been in this space for a large part of my career. We are primarily a tool that financial advisors and their clients utilize for healthcare planning. So we can help everything, with everything from initial questions and how do I enroll into Medicare and when do I need to do these things, all the way through to assisting with the enrollment and then serving you for years to come. And so with Medicare, we love the folks that we get to serve with Medicare because it really creates a lifelong relationship from that point forward, where we get to connect with these people at least once a year, but hopefully more than that. We're getting to connect with them and talk about not only health coverage, but get updates and things like that from you all. And so the human piece of that's really important. But we have an award-winning platform for financial advisors and their clients, and have been featured in a lot of different places. With that. A couple things about me, right? So maybe more importantly than my role as the co-founder and the head of growth at Move Health, I'm a husband and I'm a dad. Those are my two titles that I'm the absolute most proud of. And so with that, outside of being dad, husband, and co-founder at Move Health, we also live in an old house, and so we do a lot of old house renovation. And I'm a recovering musician. I've done that professionally in my life before, and still like to play music quite a bit. And so really involved at both my church as well as locally here. And so that's a little bit about me. This is Conrad and Porter, and they're a ton of fun. My incredible wife Megan. So let's get into it here of the Medicare basics. What is Medicare? How does it work? What are the parts of it? What are my timelines on all of these things? And so those are all questions that I will answer alongside of you today. And so feel free, again, use that chat functionality, to ask a question if you would like to. But we're going to talk about the parts of Medicare, and we're going to talk about this fork in the road that happens at age 65, which is, do I need to do anything with my Medicare? We'll answer that. The answer is yes. You need to consider it. And then what fork in the road? What direction do I go to kind of fill the gaps and things along those lines? And so we're going to talk about both traditional Medicare, Medicare Advantage. We'll give you some thought points and things to think about when it comes to I still have health insurance through my job and things along those lines, and I'm going to work past 65. We'll cover those, but we're really going to talk about the transition to Medicare at 65 specifically, if you're making a full transition. So before we can talk about what that transition looks like, you really have to understand what Medicare Parts A and B are. Medicare Parts A and B, these are what you'll hear me reference as traditional or original Medicare. So Parts A and B, Medicare's been around since the 1960s, and there's two components to original Medicare. A is, Medicare Part A is an alpha. That's the hospital portion. So typically, Medicare Part A, if you have worked 40 quarters or your spouse has worked 40 quarters, you don't pay anything monthly for Part A, right? So that's the hospital portion. So this is inpatient hospital, skilled nursing, home health, hospice, all of those things fall into Part A. The easy way to think about it, that I have a team member that says it often, is it's the bed that you're laying in the hospital, the Jello that you're eating, and the nurse that brought it to you. That's the hospitalization portion. It does have a deductible per benefit period, and we're going to talk about why that might not be super applicable for you all. It's for the hospital portion, right? So you can see home health, hospice, days 1 through 20 in a skilled nursing facility. That's Part A. Important to note as well, Medicare on its own is not a long-term care policy or thing to leverage for long-term care. That's a separate piece, but it will participate in some of the initial costs for hospice care or skilled nursing facilities. That's Part A, the hospital portion, typically premium free. Part B is the medical portion. This is everything else that's medically related, right? So the doctor that's seeing you, the surgeon that worked on you, your primary care physician, the labs that you run, the tests that you take, all of those things are Part B as in boy, the medical portion. Now, Part B, it has a monthly premium. That monthly premium is $202.90 a month. Now, the way that you pay your Part B premium is one of two ways. If you're drawing Social Security for more than 3 months before your 65th birthday, you will be billed Medicare Part B directly through your Social Security check. So you can pay it that way if you're drawing Social Security. If you are not, like many of our clients that we work with have an advisor that says, hey, let's delay Social Security or put that off for a little while. You can do that, and you just pay the Social Security Administration directly. So you can set that up on auto pay. If you like to pay by check, you can do that, but we recommend auto pay just so it doesn't go out of date for whatever reason. Part B, it has a medical deductible that's $283. An important thing to note is this, right? So I put it in bold. I put a big warning note here. Original Medicare is only going to cover 80% of your costs. So, as an example, last fall I had a knee surgery. I had an ACL, MCL, and bilateral meniscus repair. And so it was a big surgery. It was about 3 hours long, and I was in the hospital for a day. That was $100,000 that was billed for that surgery. If I was on Medicare Parts A and B only, I would have paid $20,000 of that because Medicare would have picked up 80% of it. I would have been responsible for the remaining 20%. And there's no annual cap on that. And so it's important to note original Medicare, though it is great, does not cover all of your costs. And so the then question is, how do we fill those gaps, right? So we'll make one quick touch because I talked about it I saw it on a previous slide there talking about IRMA, IRMAA. This is not a hurricane. It's not your auntie. IRMA is the income related monthly adjusted amount. That's a mouthful. It's why we say IRMA. So IRMA is basically the you did well tax, right? So you may pay more for Medicare Part B as in boy and Part D as in drug premiums. And it's actually based upon your income from 2 years ago, right? So there's different tiers that you may fall into, and it's based upon your tax filing status, things along those lines, and it's determined by the Social Security Administration. Now, if you're someone who's assessed IRMA and you have to pay more, and let's say that you are retiring at 65 and your income isn't as big as it was when you were 63, you can appeal IRMA to have it either reduced or eliminated if your income is going down. Now, for some folks that have higher income and will be higher income for the entirety of their lives, they will be paying IRMA, right? There's no way to kind of appeal it and get it removed. So that's the income-related monthly adjustment amount. If you've already made the transition to Medicare, or you do, and you get a notice from Social Security that says, "Hey, we've assessed you a income-related monthly adjustment amount," this is what it is. So you can appeal it. We work a lot of times with an advisor to say, "Hey, does it make sense for your client to potentially appeal IRMA in this scenario?" So that's IRMA. Make a quick pit stop there. and then as we kind of move forward here, we talked about how original Medicare A and B do not cover all of your costs, right? They cover 80% of them, but there's a 20% gap that has no maximum out of pocket. So if I take it even a step further and said, hey, I'm having cancer treatment, and I've racked up $1 million in medical costs, I'm responsible for $200,000 of those. Medicare may cover 800,000, but I'm responsible for 200,000. So we always recommend that you find a way to fill that gap or fill that 20%, to make certain that you have a stop gap in place or stop loss in place. And so how do you choose a coverage option? So there's a couple of different options, primary options that you can look at. Supplement, a Medicare supplement, also known as a Medigap plan. Those are synonymous. Those are going to have a monthly premium, right? So you might have a monthly premium that is between 100 and 150 or $200 a month for a Medicare supplement, but it operates on an open network. So Medicare, original Medicare A and B, is an open fee-for-service network, right? So you're not going to have to worry about, am I staying in network? Can I go to Kaiser, or can I go to Mayo Clinic, or things along those lines? If Medicare is accepted, you can go there. Why? Because a Medigap plan or a supplement is a secondary payer to original Medicare. So original Medicare, if you have A and B, you're going to hand the doctor your red, white, and blue Medicare card, which is a card that you get when you apply for Medicare, and you're going to hand them your Medigap card. And they're going to bill Medicare first, and then Medicare is then going to bill your Medicare supplement. So this allows you freedom to choose your doctors and facilities. If you want to go see a doctor I was just in Nashville, so if you want to go see a doctor at Vanderbilt, but you live in California, you can do that if you've got a supplement and a Medigap plan. So no referrals necessary. The trade-off is there is a monthly premium. You pay a monthly premium, but it does offer the most flexibility. It also requires you to have a separate prescription drug policy. So that supplement, we'll do a double click on that here in a moment. Medicare Advantage, on the other hand, typically doesn't have a monthly premium, but it does have copays and a deductible and a maximum out of pocket. So Medicare Advantage is when you select a health insurance or a Medicare Advantage plan through an insurance carrier, right? So this could be a Blue Shield of California or a Kaiser or a United Healthcare or what have you. You select that, and you now have relinquished your rights, where that insurance carrier now becomes the primary payer. So no longer is it Medicare paying first, it's a Medicare Advantage plan carrier that's paying first. And so with that, since they're holding the purse strings, they're going to say, hey, we're only going to allow you to go to this doctor, or you need to stay in network, or you may run into a scenario where someone says, I know that you seem to think that you need a hip replacement. Your doctor agrees with that. We're gonna ask you to try 90 days of physical therapy before we approve that. So there might be prior authorizations. There may be referrals to a specialist required. A Medicare Advantage plan typically includes drug coverage, but choosing a coverage option between these two, is an important decision to make when you first make that transition. And there's reasons why it's important to make particular decisions over another, and how some may lock you into options long term. And so I'll talk about that here in just a moment, but that's kind of a teaser there. So if there are any questions, feel free to fire them into the chat and the difference between supplement and Medicare Advantage. Medicare supplement, if I do a double click here, these were started in the 60s and 70s, right? When Medicare was first beginning. They were unregulated. They were standardized in the 90s. And a traditional Medicare supplement, again, Medicare A and B are the primary payer. Primary payer is an insurance term, but Medicare A and B are the primary payer. You then choose a secondary insurance company to buy a Medicare supplement through. This could be any of the large insurance carriers you think of. It could also be insurance carriers you'd never heard of before, or ones that you would think they're in the health insurance space. Like you might hear Allstate or Farm Bureau, they have Medigap plans. You go, I thought that was just home and auto, right? They have Medigap plans. So you choose an insurance company that is secondary. And then when you go to the doctor, like I said, you use a Medigap card plus your original Medicare card at the hospital. If the doctor accepts Medicare, they're going to accept your Medicare supplement. So they're never going to be able to say, hey, we don't take this carrier. You go, nope, you take Medicare. Medicare handles the rest. The two most common Medicare supplements that are currently in use in the United States and the most comprehensive are F as in Frank and G as in girl. Now, Plan F, you can't really get any longer unless you are Medicare eligible before 2020, right? So if you were 65 or older before 2020, you can still get a Plan F. We're seeing fewer and fewer of those. Most of those folks have already retired, but we see it on occasion, right? Right now, the most comprehensive Medicare supplement that you can buy is a Plan G supplement. So, right, we talked about the parts of Medicare, A, B, and D, and then we talked about plans. When it comes to plans, that's Plan G, right? Those are Medicare supplement plan options. And so those are going to, a Plan G is kind of the most popular. So if I go back here and look at a Medicare supplement, this is a chart of the Medicare supplement plans that are available in the United States, right? Plan A all the way through Plan N. The most commonly used, as I mentioned, are F and G. And why? Let's look down here. You go, holy moly, Plan F? If I'm paying my monthly premium, I have no out-of-pocket costs on a Plan F, right? If I have a Plan G, my only cost that I have is the Part B deductible, which is less than $300 on an annual basis. And so in that example, if I had my knee surgery, I'm covered by a Plan G Medicare supplement. It was $100,000 that were billed. I'm going to pay $283, which is the 2026 Part B deductible. I'm going to pay that, and then I'm done, right? I have no other medical costs. And that's for the year. And so all my physical therapy, all of those things are covered by Medicare Part B, Medicare, original Medicare A and B, plus my Plan G supplement. There are other options that are much more bare bones, right? That will cover, other pieces that original Medicare does not. But important to note, a Plan G is going to be your most comprehensive option, and we're not talking about huge sticker shock. Depending on where you're at in the country, these could be, less than $100 a month if you're in states that have either more retirees or have different Medicare laws or rules. Like a New York, you might pay a lot more for a Medicare supplement. That said, it's not a huge cost, especially in comparison to pre-65 health insurance coverage. Other things to note here: all Medicare supplements are substantially equivalent. So the way that I say this is a Plan G is a Plan G is a Plan G. So regardless of the insurance carrier, the Plan G supplement is going to cover the same thing. So there's a lot of times when you're reviewing, hey, what Medicare supplement should I go with? You usually pick the plan letter. That's pretty easy. And then there might be 50 insurance carriers that offer a Plan G in your area or in your state. You go, how do I select that? Well, the importance is you're looking for historical rate increases, things along those lines with a Medicare supplement. You're also looking at longevity of plans, things along those lines as well. And so, we help you to do that at Move Health. David had a question there in the chat. Are the supplement options subject to IRMA? They are not. So you purchase a Medicare supplement directly through an insurance carrier. And so they don't ask you about your income. They don't ask you what your Part B premium is or anything. They're just saying, hey, you now have an agreement with us for a Medicare supplement. So that's not going to go up or down based upon IRMA. That's going to be a static number. And so just prior to this, I was having a conversation with an individual who is going to be paying a lot for their Medicare, but all of their, or nearly all of their costs are wrapped up in that IRMA, right? So Part B and Part D increases. Their Plan G supplement does not go up or down based upon the income-related monthly adjusted amount. That only impacts original Medicare Part B and Part D, as in drug. Good question. That's a great question. So all that to be said, when you're selecting a Medicare supplement, know that all Plan Gs are substantially equivalent. They're all guaranteed to cover the same things. They're federally regulated to do so. That said, there are differences in how easy it is to get a hold of my insurance carrier, and have I ever heard of them, and rate increases, and do they have a small pool where they can't really distribute rate increases over a large group, or do they have a large group and they can, and so rate increases are more stable and predictable. All of those things to think about. So we help guide you through that and help make certain that you're making an informed decision when it comes to that. So we're going to help you to compare Medigap plans and make certain that you have an understanding of how it works, how it doesn't work, what it does do, what your annual financial risk is associated with each option. This is a high deductible Plan G versus a Plan G. And so what the differences in costs are. And you can say, hey, here's one that has a 250 or excuse me $176 a month premium, and this one has $190 a month. What's the difference? Well, our out-of-pocket maximum is identical. The only difference is the brand name that's being offered by it in the carrier. And so, important notes there when you're selecting a Medigap plan to think about historic rate increases and ease of use working with the carrier. You'll also sometimes see an insurance carrier that will have a really great introductory rate for someone turning 65, but then they have double-digit increases year over year for someone who turns 66, right? So we know all of those details. There are insurance carriers that do that more often than not, et cetera. And so we can kind of cut through that alongside of you all. So that's comparing Medigap plans. Now, we talked about that fork in the road of Medicare Advantage versus Medicare Supplement. We talked about supplements and how Plan G is typically the most comprehensive that's out there. There are other less expensive supplement options, but Plan G is going to offer the most flexibility and reduce your costs to the highest degree, and keep flexibility at a high level of being able to see doctors wherever you'd like to. Now, they introduced in 2006 a different part of Medicare. It is not original Medicare, but they call it Medicare Part C. I call it Medicare Advantage. Calling it a part of Medicare makes it sound like it's a part of original Medicare, which it is not, and it is not required that you take a Medicare Advantage plan. Now, Part C, it includes Part A and B and may include drug coverage. In most cases, it does. It usually doesn't have a monthly premium. Usually, a Medicare Advantage plan has no monthly premium or has a $0 cost. Now, it does have deductibles and copays that are set by that private insurance carrier that you choose. So my important note down there in the bottom right of this screen says, Medicare Advantage plan is coverage through a private insurance company that then contracts with Medicare annually. You still pay your Part B premium, but the carrier you choose sets the benefits, pays claims, and administers coverage, not Medicare. So, important to note when you take a Medicare Advantage plan, the carrier that you are with is who is administering and administering your Medicare benefits. And so, important to note that you may have higher out-of-pocket costs. And unlike original Medicare, Advantage plans do utilize provider networks. So in some states, you have PPO. It's kind of the gold standard for most flexibility when it comes to having a network. But other states, you have HMOs, right? Health Maintenance Organization, that you have to use in-network providers at all times. Referrals are required to see a specialist, et cetera. And so important to note that Medicare Advantage, though it has low or no monthly premium, has other costs that you will incur, like a deductible and copays when you go to the doctor, and out-of-pocket expenses. And so they may offer additional benefits, things along those lines as well, like dental and vision, or an over-the-counter, medication benefit for the pharmacy, things along those lines. And they'll kind of sell you on those perks to come over to Medicare Advantage. You can't use a Medicare Advantage plan in conjunction with a supplement. That's important to note as well. But that's Medicare Part C or Medicare Advantage. And so happy to answer questions there. Typically, when someone is turning 65 at Move Health, we are recommending that you go to a Medicare supplement first. And there's a reason for that. It's not because we don't like Medicare Advantage or it might not work well for you or things along those lines. It's because it retains optionality, right? So Medicare Advantage, like we talked about, it's going to bundle everything together. And so you might see a plan that has $0 premiums, out-of-pocket maximums. Your drug costs might be low depending on what your specific needs are, but you have an annual financial risk that many times is higher than a Medicare supplement would be. So you can look at that there and kind of what it does and how it bundles everything together in one plan. Medicare Advantage is going to kind of work like health insurance before the age of 65 does, where you've got a network, you got to make sure your drugs are covered on the formulary, et cetera, before you make a buying decision or before you enroll. Medicare supplements in original Medicare is much more flexibility. We'll come back to kind of some of those timelines and things along those lines that I talked about there. But next, we're going to move on. We talked about Part A and B, original Medicare. We talked about Part C and how it's not a part of original Medicare, but it's Medicare Advantage. We talked about Medicare supplements and drug plans and how they interact with original Medicare and how it's going to offer the most flexibility and how Plan Gs are typically the most widely utilized currently. But we've left out, we've gone A, B, C, and I'm from Indiana, so my alphabet's not great, but I think D is next. And that's the only one that really makes sense phonetically. It's Part D for drugs. So how Medicare drug plans work. So that's where we're at on the roadmap. And what is it, right? What you need to know. So Part D is if you go the original Medicare plus Medicare supplement, you have to buy a Part D prescription drug plan that's provided by a private insurance carrier. Some of the larger ones are Humana or WellCare or Cigna or United Healthcare, some of the large ones that offer Part D drug coverage options. You have to have Part D coverage or you risk penalties for late enrollment. A Part D plan is gonna change. The premium is going to change from plan to plan. You select a Part D plan by doing a review of saying, are my medications covered on the plan's formulary? We do that for you. Are they covered? Yes. Are they? Is my pharmacy in network? I want to go to Giant Eagle Pharmacy, or I want to go to, Costco or what have you. Can I go to those, or I use mail order? And are my drugs covered at the lowest cost? And so when you look for a Part D plan, it really is pretty black and white. Can I go to my pharmacy? Are my medications covered, and are they covered at the lowest cost by all plan standards available in the area? If the answer is yes, that's the plan that you enroll into. So you must have Part D coverage. That's an important piece of the puzzle as well. And one other note on there, Medicare Advantage plans many times include Part D coverage within them. And so always important to note that if it's an MA only plan, you have to get Part D, Medicare Advantage only, but many times, most of the time, it's Medicare Advantage and MAPD, Medicare Advantage and prescription drug. So what's changed recently in regards to Medicare Part D? There was a big change that took place. One of those biggest ones was, you may have heard of, whether it's from a spouse or a friend you play pickleball with, or, maybe through experiencing it through your parents' Medicare, you may have remembered the donut hole. The donut hole is gone, right? And so now what they've done is they've said, hey, we're going to make it easier for seniors in America. There's a $2,100 cap for out-of-pocket costs on prescription drugs in 2026. So the way that I say it is, if you have a medication that is covered by, the prescription drug plan, you will not pay more than $2,100. Many times, if it's generic medications, they're going to have a $0 or a $5 copay that's very inexpensive. But many times, if somebody says, hey, I take this medication that is brand name, and my joke is that if your drug sounds like a European sports car, it's probably going to be expensive. If it sounds like it's a Ford Taurus or something like that, it's probably generic. But if it sounds like a Lamborghini Eloquist or a Bentley Jardiance or things along those lines, right? It's going to be expensive, and you should plan to meet that $2,100 cap. But you're not going to spend more than that. So as an example, my neighbor's been on Medicare for several years and takes several name brand medications, and her costs from 2025, when this was originally rolled out, went from about $9,000 a year at the pharmacy down to $2,000 a year. So it was a big deal. So if you are on one of those expensive medications, this can be a big deal. That said, what happens when you have an insurance carrier that needs to participate in more of the costs? Well, plan premiums went up maybe a little bit. You might spend, $15 to $35 on a Medicare, drug plan, and the formularies got a little bit skinnier, meaning they covered less drugs. And so it's more important to review that every single year than it ever has been. But your out-of-pocket costs are reduced. So Medicare Part D, comparing those, right? So if you look here, there's no difference. Here's a WellCare Value Script plan versus an AARP United Healthcare prescription drug plan in this example. This person does not have IRMA that applies. There's a $100 deductible on this WellCare plan, but their estimated drug costs for the year, because there's no premium on this one, are $20. Why? Because they go to this pharmacy, they take this medication, it's covered, and their annual expected costs are $20. Because maybe they have a $5 copay when they fill their 90-day supply of Lipitor every quarter, right? Whereas a plan, with a different carrier might not have your pharmacy and network and may result in more out-of-pocket cost. So, important to do your review on Part D drug plans. Do you need to enroll in drug coverage even if you don't have, you don't take any medications? Yes, you do. Pick the least expensive plan. If not, you're going to have late enrollment penalties if you don't enroll. There are other creditable sources of drug coverage like TRICARE or VA coverage, or if your spouse is still working, you or your spouse is still working, their employer plan or your employer plan can work. And again, just ensure your Medicare Advantage plan, if you went that route, has embedded drug coverage. So that's important to note. Key learning number 3, important timelines. What happens when we turn 65? Your initial enrollment period, your IEP. Many people don't know this, that Medicare starts on the first of the month in which you turn 65. So if you turn 65 on April the 16th, Medicare actually would start on April the 1st for you. And so you have this initial enrollment period where you can enroll in original Medicare, enroll in a drug plan, during this 7-month window. It's 3 months before your 65th birthday, the month of your birthday, and 3 months after. So what you can do is enroll in a Medicare Advantage plan, enroll in original Medicare, enroll in a drug plan. If you missed this enrollment, you potentially risk late enrollment penalties and/or only specific times of year where you can enroll into Medicare for the first time. Now, it's important to note, this goes back to our conversation around Medicare Advantage versus Medicare Supplement. Enrollment into a traditional Medicare supplement that works with original Medicare is typically only guaranteed issue for a period of time. It's a guaranteed issue window, and it's only guaranteed issue for 6 months from your Part B start date. After that, you can't get, in most cases, a Plan G Medicare supplement unless you have gone through medical underwriting with that carrier. So they're going to look at your height and your weight and the medications you take and the surgeries that you've had or the conditions that you've got. They're going to look at those things and say, hey, if you're outside of that, guaranteed issue window of time for a Medicare supplement, you can't get it if you can't pass underwriting. Now, there are people that are healthy that can pass underwriting, but this is an important note that why we say, hey, let's start with a Medicare supplement, because a Medicare Advantage plan does not have medical underwriting. You can always go to an Advantage plan. You can't always go back to a supplement. And so it's important to kind of start on the right foot. Though a Medicare supplement is going to have a monthly premium, it's not going to break the bank in most cases, and it's going to provide you the lowest amount of out-of-pocket expense, and it's going to provide you with the most flexibility in terms of providers and things along those lines. So it's important to note that enrollment into a Medicare supplement, you have about 6 months from your Medicare Part B start date to enroll into a supplement, without medical underwriting. So happy to answer any questions that you have there if anything comes up. The annual enrollment period. This is in the fall, right? October 15th through December 7th. This is if you have anything Medicare, the time of year to review it, right? You can change from original Medicare to an Advantage plan. You can switch Medicare Advantage plans. You can switch from an Advantage plan that doesn't offer drug coverage to one that does. This is also the time of year where you review your drug coverage to make certain that it's meeting your needs for going into the year following. So October 15th through December 7th, we are helping make decisions with clients for what their drug coverage or Advantage plan or Medicare strategy is going to be going into the next year, right? So that plans enrolled during the October 15th through December 7th window go into effect on January the 1st of the following year. So that's important to note there. So Medicare enrollment periods, we say get it done in November. There's also the Medicare Advantage open enrollment period, which just wrapped up recently. This is a time of year where you can switch Medicare Advantage plans, drop your Advantage plan and return to original Medicare, join a separate drug plan if that happened, or you can enroll in Medicare A and B if you missed your initial enrollment period, that 6-month or 7-month window. What you can't do during this time of year is switch from original Medicare and a supplement to an Advantage plan or join a drug plan if you're on original Medicare, things along those lines. So important to note those key dates. Last thing here, key learning number 4, right, is some bonuses, right? So if you're working past 65, you can continue to work past 65. And if your job has more than 20 full-time benefits eligible employees that provides health insurance and creditable drug coverage through that health insurance plan, you can hold off in enrolling in Medicare, but you need to defer Medicare Part B. Unless you're contributing to an HSA, there's no real reason to avoid Medicare Part A. That one's usually premium free. You can pick that up at any point at 65 or older. If you're receiving Social Security benefits, like I talked about, for 3 or more months, you will automatically be enrolled into Medicare Parts A and B. So if you want to, and you're still working, you don't need Medicare Parts A and B yet, you can defer those. But if you're drawing Social Security already, you'll need to get the card, sign it, and say, I do not want this, and send it back. And that's the only way that you can defer Medicare Parts A and B if you're already drawing Social Security. If you're working past 65, be sure that you stop HSA contributions 6 months before you make a transition to Medicare. HSAs, health savings accounts, and Medicare do not mix, right? You can't contribute to an HSA when you have any part of Medicare. And so that's important to note. The reason we say if you're working past 65, stop them 6 months before you intend to transition to Medicare is because Medicare Part A can and does backdate 6 months. And so if you were someone who's 68 years old, you're leaving your job, you're retiring, and you're leaving your employer coverage, if you've contributed to an HSA, make certain to stop those contributions 6 months before you intend to transition to Medicare, or else you can be penalized for an over contribution, because Medicare and HSA contributions do not mix. Once you get to HSA, or what you can use your HSA and Medicare for is you can use it on your Part B premiums. Can't use it to pay for a supplement or an Advantage plan. You can use it for Part D premiums, and you can maybe obviously, or maybe not obviously, use it for any medical costs. But you can't contribute to an HSA once you're on Medicare. Last but not least, COBRA and Medicare are like oil and water. They do not mix. Make certain that we are not taking COBRA and Medicare, or we're not taking COBRA when we should be taking Medicare. So if you're over the age of 65 and you're leaving a job, do not take COBRA. You need to make a transition to Medicare. COBRA is not considered creditable coverage according to Medicare. And because of that, COBRA is not required to pay all of your expenses, right? So as an example of this, if you took COBRA and you didn't pick up any part of Medicare, and you said, I'm going to take that for 18 months because I like it, you then would have a scenario where your COBRA coverage is only going to pay 20% of all of the costs. Why? Because they're saying, hey, you should be on Medicare. Not our fault you didn't pick it up, and we're not on the hook for it. You should have Medicare. So, not considered creditable coverage according to Medicare, and it's not guaranteed to cover your medical expenses like it did when you were covered as an employee under the age of 65. So that's important to note there. A couple things, right? Maybe we've got some folks that are out there that can participate in the chat. What's not pictured here between these two? Looks like identical annual financial risk. Looks like the Part B premium is the same. There's maybe a little bit of IRMA that applies. What's not pictured here? That's important to note. There's a Part D plan here, etc. Annual financial risk, again, looks similar. What isn't pictured there? The big thing that's not pictured there, since I haven't seen something come through in the chat, is traditional Medicare does not have a network. Medicare Advantage has a network to contend with. You're also not seeing all of your out-of-pocket risk that's associated there, things along those lines. And so though these look similar in total annual financial risk, this is going to have a slightly higher monthly cost, but is going to give you much more predictability than a Medicare Advantage plan may. And so all of that to be said, when you look at this, you say, well, this looked pretty good in comparison from a monthly cash flow perspective, but then you find out that your doctors aren't in network. That's a big piece of that, of what's not pictured there. And so important to note that traditional Medicare supplement is going to give you the most flexibility as far as seeing doctors, things along those lines. What you should check for when you're enrolling in Medicare for the first time. We help you to do this at Move Health. You're on this call for a reason. We'd love to help you with this transition. Provider networks, make sure to check those. Your drug formulary, make sure the drugs that you take, the medications you take, are covered on the plan. Drug costs, make certain that they're covered at the most, the highest rate, and so we can help you do that. If we're exploring a Medicare supplement plan, what are their historic rate increases? Those are great questions to ask. Same thing, carrier stability. Is this a brand new carrier I've never heard of? Or is this a reputable carrier with good ratings? We'll help you to check those out as well. Verify if IRMA is going to be applying to you. And then last but not least, understand what your total out-of-pocket exposure is. Make certain you understand what your costs are and what it's going to cost when you go to the doctor, what it's going to cost when you have a surgery, things along those lines. What's that going to look like? So important. What's your next step, right? If you are working with an advisor, have them initiate a health planning analysis for you with Move Health. This is where we're going to look at provider networks, HSA eligibility, if applicable, right? Drug coverage, things along those lines. We're also going to look at carrier stability, drug costs. We're going to do the same work in the pre-65 space. There's a lot of times where not all couples that are married turn 65 on the same day, and so they have to figure out, hey, I'm turning 65, but my spouse is younger. What does that look like for them? If we're already helping you with pre-65 coverage, we've got all these details in place, and we can, easily help you with the Medicare transition as well. So we try to make it really, really simple. If you're working with an advisor that maybe sent you this link, reach out to them and have them start a client engagement for you. We'll ask for some information about you. What doctors do you see? What medications do you take? That all allow us to create this health planning analysis. We'll meet with you, we'll educate you, we'll do the health plan analysis for you, and then we can help you all the way through to the point of enrollment as well. So, all of that to be said, you've got next steps. We've talked about original Medicare A and B, how it only covers 80% of the cost. You have to pick a fork in the road, a direction to go, whether that's Medicare supplement that works with original Medicare and a Part D drug plan, or going to Medicare Advantage that kind of mushes all those things together, and the pros and cons of each of them. We talked about Part D coverage and why you need it even if you don't take any medications. And we talked about important timelines. When do I need to start talking about Medicare? When do I need to enroll in Parts A and B? What if I'm working past 65? We've covered off on all of those things. If there are any questions that I didn't get answered, now's the time to ask them. And so you can do so in the chat there, and I'll keep an eye out for it. I saw a couple questions from David during the meeting, and so thank you for those. If you have questions, don't want to put them in the chat, and you'd like to ask them to us, you can send an email to us, info@movehealth.io. We can get those answered there for you. If you're anything like me, you're gonna remember that you had a question and that you forgot to ask it, or it comes up later when you're mowing the lawn or something like that. Just shoot us a quick email. We would love to help. If there are no other questions, we can move along. Let's see. It looks like there might be one here. Let's see. David says, when I go on Medicare, can my wife, who is under 65, select a different ACA plan at that time? Really, really good question, David from Tennessee. The answer to that is no. So when a spouse, transitions to Medicare, you would have to have a qualifying life event in order to make an ACA plan change. And a spouse transitioning to Medicare does not create that qualifying life event because your tax household is not changing. Nor is your location. You didn't add someone to, no one lost coverage, right? Things along those lines. And so you don't select a different ACA plan at that time. It's a really, really good question. A spouse transitioning to Medicare is not a qualifying life event to change ACA plans. It's a great question, but not something that you can do. Any other questions that are out there? And if not, we can wrap things up here, but I'm happy to answer any other questions. David's had some really good ones today. Thank you for those. I don't see any others. And so, Josie, I don't see any others if you haven't caught any. And so, all of that to be said, really, really grateful to, to be here with you all today. Thank you for making the time to connect and, putting time on the calendar to learn about Medicare. And happy to help answer any questions that you all have. I saw one last bonus question from David that says, will the ACA premium be adjusted? The answer is yes. If you're someone who's receiving a advanced premium tax credit on the marketplace, and you may know that if you are, your plan cost for her might not actually change that much, just depending upon what your plan costs are, because a lot of times what adjusts is there's only one person needing the coverage. Say that your plan premium is $800 with on the ACA for both of you right now. You might make a transition to Medicare and get all your enrollments taken care of, and her premium the only thing that adjusted was those tax credits. So the premium will adjust. If you actually feel the adjustment is to be determined. So happy to answer those questions, specific to your situation, so we can look at those, together. But grateful for the time, everyone. Thank you for, talking Medicare with us on a Thursday in April. It's beautiful weather outside, so maybe make some time to go out and spend some time in the sunshine. And looking forward to, hearing from you all. And again, thanks. We'll talk soon. I'm Cole with Move Health. This has been Medicare and Turning 65. Thanks so much. Bye bye.